Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to know about tooth erosion to protect your smile. Teeth have a hard, protective covering called enamel. Long-term exposure to acids can wear away enamel in a process called tooth erosion. This can eventually lead to a variety of oral complications such as cavities and cracked teeth. /r/n/r/n Unfortunately, tooth erosion is irreversible. You can't replace lost enamel. But since it's a slow process, you can take steps to prevent further damage. These include good oral hygiene and regular visits to the dentist. /r/n/r/n This article discusses signs of tooth erosion, what causes it, and what you need to know about prevention and treatment. /r/n/r/nRe Thaisagul Getty Imagesrnrn Early signs of tooth erosion can include shallow pitting and flattening of the back teeth. As you lose more enamel, you might notice other changes in how your teeth look and feel, such as /r/n/r/n erosion and decay both weaken teeth. Tooth erosion occurs when enamel wears away due to exposure to acids, making the teeth more sensitive and prone to damage. Tooth decay occurs when bacteria grow and use sugars in food to produce acids. These acids can eat away at teeth and form cavities, small holes. /r/n/r/n Symptoms of tooth decay, such as heat and cold sensitivity and tooth pain, overlap with those of erosion. If a tooth becomes infected, you can also develop an abscess, swelling, pain, and fever. Other signs of tooth decay are white, brown, or black staining or cavities. /r/n/r/n The best way to know if you're dealing with erosion or decay is to visit a dentist. /r/n/r/n See your dentist every 6 months for a cleaning to monitor tooth erosion. Consider seeing them even sooner if you notice other signs, such as acid reflux. If you can, take daily selfie photos of your teeth to document any changes over time and show these photos to your dentist. /r/n/r/n Tooth erosion is caused by long-term exposure to acids, which can happen in a variety of ways or a combination of these ways. /r/n/r/n Tooth erosion can affect your appearance, causing yellow or stained teeth, shortened teeth, or teeth with rough, jagged edges. As for oral health, less enamel usually means more tooth sensitivity and pain. It also makes you more vulnerable to the effects of oral bacteria, which increases the risks of /r/n/r/n Complications from advanced tooth erosion can increase the need for dental interventions such as /r/n/r/n Tooth erosion is cumulative and irreversible, meaning it builds up over time and cannot be undone. Research suggests that there's a significant connection between tooth wear and declining quality of life due to oral health issues. /r/n/r/n Erosion is a gradual process, and it may be difficult to detect in the early stages. A dentist can usually diagnose tooth erosion based on your symptoms, risk factors, and common signals of tooth wear on clinical examination. /r/n/r/n A dentist will likely suggest dietary changes to reduce your exposure to acids, as well as changes to your oral care routine. Other treatment depends on the degree of erosion and damage to teeth. This may include treating underlying health problems that may contribute to tooth erosion. /r/n/r/n Other potential treatments include /r/n/r/n Regular dental checkups and cleanings can help keep your mouth as healthy as possible and catch signs of erosion early on. The following steps can help lower the chances of developing tooth erosion. /r/n/r/n It may seem counterintuitive, but it's best to wait at least an hour after vomiting, eating acidic food, or drinking acidic beverages to brush your teeth. Studies show that brushing too soon after eating acidic foods or vomiting may actually cause more enamel loss. /r/n/r/n Dental erosion is when tooth enamel wears thin. Erosion is the result of exposure to acids such as citrus foods and soft drinks. Stomach acids from frequent vomiting or acid reflux can also be a problem. As erosion progresses, it can lead to complications from tooth decay. /r/n/r/n Shallow pitting and tooth sensitivity are signs that you may have tooth erosion. Once the enamel is gone, it's gone for good. You cannot replace it. Regular dental checkups can help detect erosion early and prevent further damage. You can lower the chances of tooth erosion by limiting acidic foods and drinks and practicing good oral care. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.